Welcome back to Sunrise. Well, the 2024-25 Master of Public Health Cohort of the Department of Community Health and Psychiatry at the University of the West Indies is hosting a World Diabetes Day Health Fair on Thursday, November 14 this year at the Undercroft at the Faculty of Medical Sciences. The theme for this year's event is Empowering Global Health, Stepping Beyond Diabetes. And as the faculty aims to raise awareness about diabetes and promote healthy lifestyles and encourage early detection and prevention.
Joining us this morning to tell us more are the Director of Clinical Services, Primary Care Physician, Master of Public Health student at the UWI Mona, Dr. Kachelle Williams, and Director PR and Marketing of the Master of Public Health student at the UWI Mona, Jada Francis. Welcome, ladies.
Welcome,
how are you?
ladies.
Good morning.
We're so good. It's nice to be here.
Lovely to have you because it's a very, very important topic that affects so many across the length and breadth of Jamaica. So talk to us firstly about how common is diabetes in Jamaica? Anybody can take that.
So I'll take that, given that I'm... So diabetes is common globally. The rates have been rising. It's about 18% globally, and in Jamaica we are on par with that. We're at 17.9%. So it's something that is affecting a lot of persons, and it's bad. It's bad because the effects of diabetes across the entire body means that it will, it's a chronic illness, so it will affect you for the rest of your life, and it affects all organ systems.
Right.
So what that means is that it will span across all specialties, and it will affect you across the rest of your life, so at all ages, and that is the issue.
Jada, help us to understand, though, how me being diabetic and taking my metformin or whatever it is that I'm prescribed, how does that translate now to being a public health issue for you, like as you study public health matters on a more macro level?
That's such a great question, because diabetes is something that affects everyone. If it's not you, you know, your family member, a friend.
Which is why I know about metformin.
Right.
Yes, right. And there's another one too.
Yeah.
Right. Yes. And this month is Diabetes Awareness Month. So we want to spread awareness as the public health students at UE about this chronic illness. And something else that we want is for persons to understand that it's something that is preventable. We want them to know that there are healthy lifestyle changes that they can make. And our lecturer, Mrs. Walter, she challenged us with this assignment to come up with a health fair under the theme World Diabetes Day. And we were able to just analyze and put together, because we have such a great cohort with different health professionals, and we came together and were able to develop this, because we know that this is something that not only UE needs, but Jamaica needs today.
Absolutely. And in terms of talking about, you know, it's a non-communicable disease.
Right.
Jada just said it's preventable. Talk to us about what is it that we can do, because some Jamaicans, unfortunately, you know, say me sweet, you know, and it's almost as if diabetes and hypertension are somehow a rite of passage to old age as a Jamaican. Right. You know, it's like if you have diabetes, but the effects thereof or therein are very, very significant. So talk to us about prevention. How can we prevent and also manage?
All right, so one of the things I want to start with is just highlighting that diabetes is what Jamaicans would call sugar. Right? So that's the first thing. And some of the ways that we can prevent it before the onset of diabetes is through lifestyle changes. So these need to be something that you can do every day for the rest of your life, and that is one of the things that we're promoting with our health fair. So that includes your 30 minutes of exercise daily, and these are things that you can do at home. You can use your workout videos. You guys have a lovely program in the mornings with Camilla. But also, if you're not home at that time, you can watch YouTube videos, etc. You're skipping, you're walking in the park, you can walk in Emancipation Park, you can walk around your yard. But it also involves swapping out unhealthy eating habits for healthier options. So decreasing your sugar consumption to about 6 teaspoons of sugar per day, which is really difficult for a lot of persons to do, but that is the actual recommendation. And it also includes restricting and maintaining a healthy weight, which in the Jamaican context is a little cultural, because for us, you know, we like to have a little flesh on our bones, but it has been, research has found that at least 10% in weight loss, so you don't even have to be at a normal weight, but at least 10% in weight loss has actually decreased your risk of developing diabetes. And this is important because we found that children are now being more obese than in previous times. And so the age that we're diagnosing diabetes is no longer an old person's disease.
Right.
You find persons in their 20s and in their 30s being diagnosed with diabetes.
Wow.
And so this is something that is becoming a public health issue, or is a public health issue.
Jada?
Out of fear. Yeah.
Yeah, so another challenge that people have in managing their diabetes, because having it is one thing, and knowing you have it is another thing, and then managing it is in relation to just knowing your numbers, monitoring, screening.
That is
I gather that at the fair you'll be having that component.
Definitely. So we are having a component, Kachelle heading the clinical aspect.
Nice.
We're going to be doing blood pressure, blood sugar checks. We're going to be doing BMI screening, and we're going to be going deeper. We're going to be doing nutrition counseling. We're going to be doing oral health education. We're going to be doing mental health counseling, because diabetes does not just affect a singular organ. It's all things, and it's a holistic thing that we want to ensure that everything is targeted. So this health fair is special because we're targeting so many areas for free, and we want persons to know that they can come out and get these checks done quickly. And we will also be having activities, interactive activities, so that you can know more about diabetes, and the education will be given to you in such a way that you will be able to leave and spread it and tell others.
So where will it be held? What time will you start?
We're going to be holding it at the Undercroft, at the Medsci, that's at UE. We're starting at 9 a.m.
Where's Medsci? Like, if somebody has never been to UE before, where up there that is?
All right, Kachelle, I think you'll be better suited to give directions.
Okay, so if you've never been to the campus before, the first thing I will say to you is when you get to the gate, tell the security guard, I'm going to the UE Mona Faculty of Medical Sciences Research and Teaching Complex, right? So that's the first thing that you'd want to do. However, you would continue around the ring road. It's the very big building to the left of the Faculty of Law.
Yes.
So you can't miss the Faculty of Law. They have a big sign, and it's the very big building to the left of that.
Like it's a grey and it's a metal and grey building.
So like when you go around Ring Road, you make the left.
Like you're trying to go to the hospital.
After you pass Peach Building, and like you're going up to the hospital. And then you...
Is that right?
And that is the building. And we'll be on the outside, and we'll have persons out there to greet you.
Yes.
And of note, we'll also be connecting the participants on that day to the public health system.
Nice.
So there's room for follow-up. It's not just a day where you get a card and a number and you get a little information and then we just leave you dry.
So like them can get them NHF and them something and all that?
They can be linked to the services that will give them that.
Ladies, this is such a wonderful initiative, and I want to thank you and your team, your cohort, for this. I know Jamaicans will appreciate it, and it will definitely change and touch many lives. And I hope that Jamaicans will come out and go to these events. It is absolutely free, so there is no reason you should not make yourselves available. Thank you, and I wish you all the success.
So much.
Right.
Thank you.
And the lecturer for QA.
Yes, that's Jada right there. Jada.
Prof?
What's your name again, Miss What?
Miss Walters.
Hi, Miss Walters. Good morning, Mrs. Walters. You're A students.
Our guests have been Dr. Kachelle Williams, Director of Clinical Services and a primary care physician. She's a Master of Public Health student. Also, another Master of Public Health student is Jada Francis. Of course, go on out to the UE Mona and get into this health fair. The youth will be giving back when sunrise returns.